Hello, 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 and welcome to Walk, Talk, Health. As the name suggests, you and I are going to take an amazing walk together and discuss health. Each one of these walk and talks can have a significant effect on your overall health, but combining the topics we discuss over a series of these walks and talks can have a major effect on your health, well-being, longevity, and help you to live longer, healthier. So where are we today? Well, we're in Windsor, and we're going to get to see the amazing Windsor Castle a little bit later on. You can see the castle there in the background. Today we're going to be talking about the vitamin D and how it plays an essential role in preventing and fighting just an amazing list of illnesses. We've known about the benefits of vitamin D since the 1920s, when they realised that putting tuberculosis patients out in the sun had dramatic improvements in terms of curing. They also found out that it cured rickets, psoriasis, and had a big effect on rheumatoid arthritis. So what is vitamin D, and what role does it play, or how do we get it? So the first thing is it's actually a hormone. Our skin interacts with UVB, the light spectrum from the sun that unfortunately causes sunburn and DNA damage. Good news is that sunblock does not interfere with the body's ability to take those rays and turn them into vitamin D, and stores them in the liver, the kidneys, and in fat cells. When the body requires the vitamin D, it then converts it into an active form of vitamin D, and that's when it starts to have those amazing health benefits. The amount of vitamin D produced very much depends on the amount of skin that is exposed to the sun. The more skin that's exposed, the greater the vitamin D production. Our body, under perfect conditions, can actually produce 25,000 international units of vitamin D per day. So the government recommendation of something like 400 IUs per day is woefully inadequate. And the various studies we're going to talk about today are going to back that up. I personally take 5,000 international units per day. Depending on where you live in the world, obviously the Northern Hemisphere gets far less sun, but as little as 20 minutes a day with the right amount of skin exposure can really top up the vitamin D levels. I think the ideal average is about an hour, but of course I would highly recommend you wear sunblock and sun creams to make sure that you don't get burnt in the process. I'm just going to stop and show you all these ducks and geese. They're crazy, whole sec. I think there's a bit of a feeding frenzy or something going on here. Oh yeah, look, they're being fed. So cool. I'll leave them to their lunch. Because of our Western lifestyles, a lot of time being spent indoors and being covered up, I can almost guarantee that if you're watching this video, you're deficient in vitamin D. So why does that matter? Well, whilst the exact process of how vitamin D acts within the body is not yet 100% established, clinical studies conclusively, 100%, prove the beneficial effects of vitamin D in so many illnesses that we face in today's modern society. In addition to those illnesses discovered in the 1920s, vitamin D helps prevent and cure and fight colon cancer, prostate cancer, and breast cancer. The list of illnesses that it actually helps prevent and fight are absolutely incredible. Almost hard to believe, but as I say, there is many studies out there, double-blind, placebo tested, where people don't know whether they're actually getting the vitamin D or not, that proves the effectiveness of such a simple and cost-effective vitamin. The reason vitamin D helped with rickets, as they discovered in the 1920s, is because it helps the body pull calcium out of the food we eat and into the blood, where ultimately we want it to make it to the bones to strengthen the bones. As regards to the immune system, in particular, it helps with breathing type illnesses. So it was an interesting point that was noted that during COVID, the people that suffered the most were those that were deficient and low in vitamin D. Two of the big ones for me is its effect on diabetes, or more to the point, pre-diabetes. In clinical studies, it had up to a 78% reduction in people, the risk of people developing full diabetes, even though they had pre-diabetes. And the other big one is rheumatoid arthritis, which I have family members that suffer from that, and it's terrible, the pain, etc. involved. And it turns out that high dose vitamin D, 20,000 IUs per day, has an enormous effect on reducing the overall pain threshold and levels. I think it's worth noting that once you start taking vitamin D as a supplement, there are two choices. There are vitamin D3 and vitamin D2. Vitamin D3 is the better of the options if you have a choice, because the body has an easier job of converting that into the active form of vitamin D. And therefore a combination of vitamin D3 plus natural sunlight, getting out and walking like we are today in some beautiful surroundings, really will, your body will thank you. If you choose to take the supplementation route, which is the one I would recommend, we all live way too busy lives to get sufficient vitamin D naturally from the sun, unless you of course work outdoors for a living. That can take up to 12 months before your body level, in terms of its ideal levels of vitamin D, gets to where it needs to be. If you want to find out where your vitamin D levels are before you start taking a supplement or enjoying more of the sunshine, you can get actually a quite simple blood test that will tell you. In fact, I think this should be a standard blood test that people over the age of 30 get on a annual or biannual basis, because vitamin D is that important. Many health professionals out there actually say, test, don't guess. But in my opinion, based on the research I've done and the various health professionals I've followed over many years, it's a foregone conclusion, as I said, that if you're not already exposing yourself to sunlight and taking vitamin D as a supplement, you will be deficient, and that can lead to all kinds of health issues. These birds are fed so often that, as you can see, they follow people along the paths because they expect to be fed, and surprise, surprise, in this case they just were. So pretty smart ducks and geese. They know where to get their next meal from. Okay, that's a bit random. Just come across a World War II Spitfire being displayed. Pretty cool. Let's see if we can get a better shot. Huh. That's very cool. And here's some more footage from the front. So why don't we hear more about vitamin D and the importance of taking vitamin D? Well, if you ask me, and I can be cynical, it's because there's no money in it. There's no longer a patent or a patent, depending on where you live in the world, on vitamin D, and it's dirt cheap. So why recommend a simple, cheap and effective vitamin that can cure so many illnesses that we face in today's modern society, when they can recommend and sell an expensive man-made drug instead? As I say, that sounds cynical, but unfortunately I think there's some truth in it. Earlier I mentioned that vitamin D helps the body pull calcium out of our foods, which is very important for bone health. especially as we age. You know, one of the biggest killers of elderly people in the world is after they fall. Quite often when they fall down, they break something like a hip. That makes them immobile, and because they're immobile, all things like organ failure starts to happen. And so keeping our bones strong and healthy is really important. But obviously too much calcium in the blood can cause issues like calcification of the arteries. So what I recommend, or health professionals recommend, and I certainly take, is K2, not to be confused with K1. K2 is something that actually helps D3 activate, it helps D3 do what it does, but it also takes calcium out of the blood and deposits it directly into the bones where it's needed, and the teeth as well. So I personally take the 5,000 international units of D3, and I also take K2 with MK4 and MK7 in it. That's quite important too. If you do some research on your own into K2, you'll see that some offer just MK7, but MK4 and MK7 also have their own individual health benefits. There are some natural foods that contain D3, but very few, and the amount of D3 in them is incredibly low, but it doesn't harm or hurt to eat fatty fishes and mushrooms. They're the main ones, but again, nowhere near enough to have the benefits that we need in terms of our health and longevity and well-being. Other major benefits that D3 has as we arrive at the start of the castle, you've got some amazing footage to come, is it helps prevent heart disease, kidney damage, and an interesting one is depression, and in particular SAD, seasonally affected disorder. So another reason to take vitamin D. Starting here down at one of the gates, and progresses a long way up there, which we're about to go have a look at. Windsor itself is a very pretty town, lots of old buildings, lots of English pubs of course, lots of tourists, big group of them there. Just heading more around past the castle again. Look at that, it's crazy. Beautiful. So let's do a recap. We know that we've understood the benefits of vitamin D, which is actually a hormone, since the 1920s, when it cured things like tuberculosis and rickets. We know that we get it naturally from UVB, from the sun, and it's dependent on how much skin gets exposed to the sun and how long we're out in the sun. We know it helps prevent and cure a plethora of modern day illnesses, and if we're deficient, your chances of getting those illnesses increase dramatically. You can supplement, choose vitamin D3 or vitamin D2. Vitamin D3 is better from the point of view of the body converting that into an active form of vitamin D. And if you take it with K2, what it does is takes calcium out of the blood and deposit it in the bone. That's important because one of the main functions of D3 is to actually help the body take calcium out of the food we eat and put it into the blood. But too much calcium in the blood, of course, can cause calcification and heart blockages and artery blockages, causing heart issues. Also, K2 helps D3 actually do the very functions that it's it's important that it does. Okay, I'm going to ask you a huge favour now. This channel isn't monetized in any form. Its sole purpose is to reach as many people as it can to help them on their health journey. So could I ask you please to like, comment and subscribe? And if you really want to help the channel, share it to others in the hope that I reach as many people as I can and help them live longer, healthier. Usual disclaimer, I'm not a health professional or a doctor, and whilst I've learned the things that I impart in these walk and talks from some amazing health professionals, I have to recommend you speak to your doctor before you make any changes. I hope you've enjoyed this walk and talk and have received some benefit from it. Please join me next time when we'll be discussing ways to support the microbiome. So we're talking about probiotics, everything from fermented foods to strains of bacteria that support the microbiome. If you want to know why the microbiome is so important to our health and how all health starts in the gut, I'd recommend you check out my video here all about the microbiome.